Hey, what's up? This is Dr. Taylor Krick at the Washington Wellness Center, and this is our segment, Ask Dr. Taylor Anything, where we take some common questions, and I get 3 minutes to answer it. So, today's question is,
I think I may have an autoimmune disease, but I'm not sure. What should I do?
I think I may have an autoimmune disease, but I'm not sure. What should I do? Okay, 3 minutes, go. So this is a really, really common question, or somebody might even know they have one autoimmune disease, like they know they have like Raynaud's, or they know they have Hashimotos, or they know they have something, but they're wondering, do they have any others? Or we get a lot of people that on their intake paperwork they say, I feel like my body is attacking itself, but every time I go in, my labs are normal. So I think that's the first thing to talk about is lab work and detection. So there's many things that we can do. One is called a multiple autoimmune reactivity screen, and it looks at probably like 30 different tissues in your body to see if you have autoimmunity. So it looks at different gut markers, ANSA antibodies, parietal cell antibodies, so like a pernicious anemia in your stomach. Do you have Crohn's or ulcerative colitis or kind of autoimmunity against your gut? Do you have autoimmunity against smooth muscle like in your bladder, like interstitial cystitis, or of your gut causing kind of IBS or IBD? And then it goes south from there. It looks at, do you have autoimmunity against your heart? Do you have autoimmunity against your connective tissues? Not rheumatoid factor, but autoimmunity against collagen, against fibrillin, against your thyroid, against your brain, against your bones, against your liver. I'm picturing the panel in my head, and it just goes through all these tissues, like some of the most common ones, so you can find out, do you have other autoimmune issues elsewhere? Sometimes the testing is expensive. So sometimes somebody comes in here and they know they have rheumatoid arthritis, they know they have Hashimoto's, they know they have MS, and our goal is just, okay, what can we do to balance the immune system? Other times we're looking more for, okay, we don't care what diagnosis is put on it, but we know you have these symptoms. We need to look at what's triggering it. We need to look at gut health. Do you have a leaky gut? Do you have inflammation in your gut that's allowing things in, that's kind of the gateway to autoimmunity? Or do you have exposures to certain toxins? Or, we look for what is the trigger. So there's a lot that we can do, and what we base that off of is what somebody's goals are. Some people want to know what's going on, so we're going to do more lab testing. I think that lab testing is always appropriate. Some people just want to know, like, what can I do to get out of pain? What can I do to just improve my symptoms? So we might go right into supplementation and other lifestyle strategies, detox things like that. Most people are somewhere in the middle. So we're doing a lot of, hey, what do you want out of this? We can do a countless amount of lab testing. It's all justified. It all makes sense. And we also can do a countless amount of, treatment options. But usually it's somewhere in between, and finding out what works for each individual case. It's very personalized.